I will touch on many of the same topics that Michael did with a different perspective and different conclusions in many cases. Yeah, I think as Michael has indicated, in the last several years, we've seen dramatic price cuts in generic drugs in Canada. So obviously, and so far we're agreeing on everything, obviously the economic rationale for using generics has never been stronger. If you can fill 4 or 5 prescriptions for the same price with an equivalent product, go ahead and do it. And we would encourage all payers, provinces, others, and individuals to go ahead and do it more so. A couple of numbers, put things in perspective. In 2012, 559 million prescriptions in Canada, 63% are filled with generics. And that's been increasing in a very healthy way. The percentages have gone up from about 45% a few years ago to 63%. Not surprising, perhaps. Prices have also come down, so the value of generics is greater than ever. In terms of costs, they represent 24% of the costs. So, you know, you can drive generic prices down to pennies, but you're still only dealing with 1/4 of the cost of prescription medicines in Canada. You're not going to dramatically change the cost curve by continuing to drive generic prices lower and lower. On the other side, brand name drugs filled account for about 76% of the costs at 24% of the 37% of the prescriptions, about 75% of the costs. If we look at the average retail price for generics, it's now at $25 in 2011. That's the red line below. And you can see that that's actually bending down. And it's on average lower now than it was in 2007. On the other hand, the average prescription cost of new brand name medicines and existing brand name medicines has continued to increase. So the gap is increasing. Quickly looking at prices across Canada, all prices are regulated. British Columbia had 35, it's going to 25. It has regulations saying next year it's going to price at 20 for the majority of generic products. You can see the other provinces as well. Manitoba has a separate system of utilization management agreements where the prices sometimes are not transparent. Right on the bottom, a very important point, all provinces do have a system allowing for price exceptions. Not all products are made the same, and if a price goes below the cost for a company, whether it's a difficult-to-make product or a single-source product or a low-volume product, private sector companies will not provide it. So provinces allow for price exceptions, and those are traditionally negotiated between the supplier and the company, or the payer, in most cases the province. And on and on. Quebec has a best available price rule that they say they will not list your product in Quebec if you're any higher than anywhere else. There's actually a typo on my slide, on the very bottom slide. Newfoundland and Labrador, the price is at 35% in April 1, not 25%. I missed that. So you can see we have a heavily regulated market across Canada. And then, again, most recently through the Council of Federation, 6 leading generics, the 6 leading generic products have been reduced to price of 18%. And the Council indicated that they thought they would save $100 million. That's simply for the drug programs themselves. I think that's also a conservative number. When you look at that pricing, if it extends to private sector payers, it's 2 to 3 times larger than that in terms of savings. And these were not small products. These were chosen because they are the largest products that would provide the greatest savings. So this has been a period of dramatic price changes for the industry to adapt to. And I will come back and make a few editorial comments on that. So we faced a situation over the last 5 years, price reductions like we've never had before in Canada. In addition, a number of people are calling for tendering as an option to be looked at. In fact, the premiers had indicated their interest in tendering on what they At that time, we're talking about 3 to 5 products and seeing what the situation would be. We commissioned a study by 2 leading health economists in Canada, Aidan Hollis at Calgary and Paul Grudendorst, University of Toronto. And here are some of the issues that they raised that I think need to give policymakers and payers in Canada pause for concern when they're considering tendering. Potential drug shortages, less redundancy in the drug supply system. Clearly, if you tender, whether it's 1 or 2 companies, you've got less redundancy than you do if there are 5, 6, 8 companies. And you can build in whatever safeguards you want, but you have less redundancy. If there's a problem with a regulatory problem with the Food and Drug Administration in the United States, which we saw last year with the Sandoz shortages, and that was in the hospital market where they use tenders extensively, there simply aren't other companies sitting waiting with stocks of products ready to go. And people have to go around and try and find supplies, and that takes time, that's costly, and that's inefficient. Less patent litigation, I'll come back to that, but clearly that's an important aspect as well in bringing generic drugs to market. You can price the generic as low as you want, but if you can't buy it because there's a patent blocking it, then you're paying the brand price. So what have you gained? Less manufacturing of generic drugs in Canada. Canada has a very successful generic drug industry for several decades now. Tremendous amount of investment, jobs, we have over 10,000 jobs. Exports out of Canada, brings in a lot of income for the industry and for Canadians. Could be some closure of generic manufacturing plants in Canada if they're no longer viable. Less competition in the generic markets in Canada. You get a low price now on a tender because 5, 6, 8 companies could bid. Going forward, those who don't win the tender often take that product out of their portfolio. They no longer continue to have that product available. It's too costly. They can't keep the plant and equipment sitting idle, hoping that in some future date they're going to win a tender. Less customer service offered by generic suppliers to pharmacies. I'll say a few words about that later, but I suspect maybe Jody will also say something about that. And less service for pharmacies to their customers. Coming from the support from generics. Just wanted to say a few words on patent litigation. You know, the Patent Office in Canada gets tens of thousands of patent applications a year. Hundreds of those and thousands of those are from pharmaceutical companies. These patents are complex. They're intended, obviously, to provide monopolies, patent thickets to keep out competitors. That's why you have a patent. You want to protect your invention. What we've found in Canada, we don't have a system of opposition in Canada for patents, so the only place to challenge them is in court. We have a very complicated system in Canada. It's biased one way in favor of patent owners for pharmaceuticals. We have separate regulations for them. They get an automatic block against a generic coming in simply by alleging patent infringement. Those actions are very costly, and 75% of the time, the generics are actually successful. They don't always challenge every patent. The patent on the basic ingredient may not be challenged, but they often challenge subsidiary patents, because in some of these leading products, there can be 6, 8, 10, 15 patents. Without the generics doing that, as you can see on this chart, we would wait for several more years in Canada to get those products to market. I think that we need to think very seriously about driving prices down, because we will lose this ability to continue to challenge these patents. And right here just on this chart alone, we're showing you the billions of dollars saved by the generics coming to market before the last patents expired. International price studies. And I would say that the previous comparison, I think, was very misleading. I think the two non-Canadian comparators, the Veterans Affairs in the US and New Zealand, are probably the 2 lowest prices in the world. If our intention is to get the lowest price anywhere in the world, yes, that's what we want to compare ourselves to. You won't have an industry in Canada. You won't have patents coming early. That is not the average price in the United States. That is not the price in the United States that supports an industry. I think if you want to look at prices, you should take an average. Canadian prices are much more consistent across Canada, unlike in the U.S. where we have a multiple of factors. More generally, when other studies are done, such as the PMPRB, I think it's important to know that they're measuring ex-factory prices. They do not reflect the total cost of payers. Prices are on invoice, off invoice discounts, free goods, rebates, etc., are not included in the prices that those studies are comparing. They do not reflect the manufacturer's net price. In Canada, retail reimbursed prices include significant support for pharmacy. Pharmacy is not allowed to upcharge the price to the government payer. If the price is 18 cents, they'll get reimbursed 18 cents. In other countries in the U.S., retail purchasers do upcharge the prices much more. That is not the Canadian model. So we need to be very careful when we're comparing prices and saying that Canadian prices are higher. The model is different, and we're not always comparing apples to apples. You know, our solution, let's try and put in place some effective measures to increase generic drug use, try and get it up to the U.S. levels. Some of our proposals are faster generic drug listings by the provinces. We see no reason why they couldn't add products to their formulary within days after Health Canada approval. We should have a national interchangeability policy. Once Health Canada says something is equivalent, it should be accepted across Canada. We should have governments promoting the use of generics. The Food and Drug Administration is very active in doing that in the U.S. Private payers should enforce low-cost alternative policies, no substitution policies. They need to be aggressive in looking at these new brand name cards. There are a number of measures that we would like to work with the provinces, provincial governments, and payers to increase generic drug use, and we think that would provide much greater savings than driving down pricing from 18% to some lower percentage. So there are ways to take advantage of generics. My last slide, just to show across Canada, province by province, for a 1% increase in the use of generics, here are some of the savings. So we're in British Columbia, $14 million every time generics are used by 1% more. There are real practical things that could be done to increase that use, and I would urge policymakers and others to, academics and others, to be promoting those kinds of policies as well. Thank you.